Correct me if I'm wrong, but I feel like has been a recent push towards normalizing breastfeeding.
Sure, absolutely.
More so than
we've made great strides, and in this
Okay.
part of the country in particular, the Pacific Northwest, very much so.
I didn't catch a lot of flack for my breastfeeding video. In fact, it was really
did?
well received. I did not.
Oh, you did not?
No.
It was great.
I got close to 100% as you can get. One gal said, tired of mansplaining or something like that. Before I even got a chance to see the comment, there was 8 women that came to my defense, which was really nice to see because it was a very supportive community there.
Mansplaining. You know what? That's another part. There are not nearly as many IBCLCs of color as anybody would like. We're a very white crew also. It's expensive to become board certified in lactation, and there are a lot of barriers. People who are looking for somebody who they can identify with, there's a big push to try to get more women of color board certified.
And are there programs out there to try and facilitate that?
There are. There are more, there's a real push towards mentorship because it's hard. Unless you're an RN or a La Leche League leader, it's hard to get the woman contact hours that you need. Many women have got to find, or many people have got to find another IBCLC who's willing to take them on and let them shadow them for months, a year,
Really? So that's a lot of contact hours.
A lot of contact hours.
The question I had.
God, this is decaf. Go on. Too much fuel on the fire here with me when I'm talking breastfeeding. I don't need any caffeine. So.
Question I had, baby's breastfeeding. Is there a point that mom just runs out, like mid feed, and baby's kind of like,
where'd it go?
Yeah, bartender. I'm dry down here. Come on, hook me up. Like.
Then you switch sides.
That's true. Switch sides.
Just switch sides. And what will happen is that unless baby is really pissed off, and they might be once in a while, they'll just say, all right, fine, I got what I can get. And I'll just want to breastfeed again in 15 minutes as opposed to in an hour and a half. They'll just come back, they'll just cue, they'll want to breastfeed more frequently. The important thing to remember is that breast milk digests very quickly. It's not like the big Thanksgiving meal that is like formula and that will stay in their tummies a long time because it's hard to digest. It doesn't knock the babies out to the same degree. It doesn't put them to sleep. Oh man, I'm full. They wake up. They're not stuffing themselves. I always say babies who breastfeed have been born into a fast food world and they know nothing but fine dining.
That's a nice way to put it.
They just want to leisurely nurse when they want it, whenever they want it, and they don't need to stuff themselves. From their perspective, there's going to be another crack at the breast whenever they need it. That's sort of their biological drive. And when people say, how many minutes should the baby be on the breast? Baby needs to be on the breast as long as the baby wants to be on the breast. How would you feel if you were having a fabulous gourmet meal and you had a waiter going, are you done? Are you done? Can I take your plate? Can I take your plate?
Well, I can tell you how I feel.
Like, go away.
Exactly,
and
yes.
So those are the thoughts I imagine go through babies' minds too.
Yeah.
In lactation, there are all kinds of things that sometimes babies are born with kinked necks and they came out asynclitically, and so they've got asymmetrical jaws.
Okay.
And, their cranial nerves have been zapped because of vacuum extractions or whatever.
Yeah.
You can send people to cranial sacral therapists. It's like really sophisticated baby massage. It can make a huge difference, and it is documented. But do you have a mom who's going to be able to find those providers, get the appointment, pay out of pocket? It's tough. And as a lactation consultant, I try really hard not to make that call for them. I will say there are a lot of different things that you can do.
Lay out the options.
Yes, the potential benefits, and say, what is going to work for you.
I've not looked up this term, admittedly, but I've seen it so often. Tongue ties.
Sure.
What is that? I've seen it all over my pages, and I've been like, I gotta look that up.
40 years ago, people were almost exclusively bottle feeding. It didn't matter. My little friends in first grade were being pulled out to go to speech therapy because maybe they had too tight a tongue. And it's the little band of tissue under your tongue that did not dissolve through the process of apoptosis. They have too much of a band of tissue holding their tongue in place or reducing its mobility.
Too much?
Yes, it's holding it in place too rigidly.
Is it shorter or is it longer?
Usually shorter, and it has to do with placement on the floor of the mouth and then also at the tongue. If an IBCLC has any concern, you want to refer to a practitioner who also has a lot of experience with that.
And so is there any sort of surgery that needs to happen? Or?
I'd hate to even call it surgery because it's so minimal. It's like a clip. Yeah. Like you look at that little band of tissue on your finger and it's just like clip.
I would not want my frenulum cut.
I have known people who've done it though, and it's cleared up their speech. For one gal I know, she had it done because it was so tight, it was causing all kinds of recession in her gum line. And then another woman went off to Mexico and she couldn't roll her R's. hours speaking Spanish. You know that business. She had a little girl teach her how to compensate for it because the little girl was tongue-tied. How do you do it and compensate when your tongue is restricted? And yes, when her baby was born, the baby needed to have a tongue-tie revision.
Yeah.
The practitioner did hers too because they run in families that can be hereditary.
So the issue with that is that the tongue's not coming out enough, and that's an important part in latching, right?
Coming out is only one aspect that we look at. How does it lateralize? How does it elevate? How does it undulate? One of my first clues to look more deeply in a baby's mouth is what is the shape of the palate. Because if a baby has a super high palate, then I think, ooh, that tongue was not loose enough to get up to the palate and to mold it more correctly in utero.
Gotcha. So dealing with tongue ties, you'd say there's people that specialize in that even further, and then surgery would be the option if necessary.
An intervention. Super minor intervention.
It's not like they need to go under general anesthesia or anything.
No anesthesia. Sometimes some lidocaine.
Yes, sometimes a little bit of lidocaine.
Yeah. And why is there suddenly such an explosion of tongue tie? There are a lot of older practitioners who are like, this is just the diagnosis of the day. There is a theory out there that because women are so conscientious now about taking folic acid during their pregnancy, it has affected the frenulum, and that's why we're seeing so many more. Plus, so many more women are interested in breastfeeding. But the folic acid is preventing spina bifida. It's preventing neurotube defects. And so, man, if I had a choice between a neurotube defect and tight frenulum, I'll vote for the, I work really hard not to scare the bejesus out of new parents.
Yeah.
Anyway.
You avoid the word surgery. You avoid
the word. This is a variation of normal. And it's easy. I mean, man, you got to treat these new parents. Their anxiety level is so high. Even the ones that look like they're really got it together and they're cool and calm, inside they're churning.
When I asked about, what videos should I do next, I had a lot of people that want to talk about postpartum depression. Like a lot of people just dismiss it as something that doesn't exist. After knowing a lot of women that have really gone from being really even keeled to suicidal. But there's some serious stuff that happens. I mean, you can't deny it.
We've got a lot of mental health issues in this country.
We're separate, but all influenced. Well. Yeah, and they all influence that.
I will say though, breastfeeding is protective against postpartum mood disorders. They can still occur, of course, but it is another thing that is protective of. The first couple of weeks, people talk about, baby blues because I'm a new parent. Oh my God. And it's very disrupting and it's very intimidating most of the time. Now you have this little tiny human that, oh my God, I gotta keep this thing alive. It's not a goldfish. I can't just flush it if something goes wrong.
So Chrissy in Maryland would like you to talk a little bit about chest feeding. She says a lot of people don't know that it's possible. How does it work? What is it, first off, for people that don't know the term?
It is a transgender man who may or may not have birthed naturally a baby who wants to provide breast milk, his own breast milk, to the baby. And trans men who have not had top surgery, they're going to be fine with that. They're going to be just like any other person trying to initiate breastfeeding. There are some men who might have already had top surgery, but still want to go through the experience of trying to provide as much breast milk or chest milk as possible.
Why do they call it chest feeding and not men have breasts too? Why is it chest feeding and not breastfeeding with men?
I think for a trans man, it is so disruptive. They've already gone through a huge awakening or a huge emotional transition, and then to sort of sidestep to participate in an activity that is so female does another head trip on them a little bit.
I can see that. Yeah.
There was this great research article that I read. It was all about trans men who were giving birth. And the title of the research article was, it was the only way we could become parents. People who never even knew that they had a feminine body, now they're having to reveal that through a pregnancy because they so very much want to be parents. And then they're having to retread that difficult journey that they made to honor their true selves.
Yeah.
They call it chest feed because it's easier than calling it breastfeed. It's more compatible to who they are. And you know what? They're the ones who get to decide what they want to call it.
How would you help a mom that is having difficulty latching a newborn?
Try different positions. Go through what the mechanics are of good positioning techniques. When I get started with a mom who's struggling in that way, I always say it's a 3-step process. You got to get in a good, comfortable position. You got to get the baby in a good, optimal position, and then you focus on latching. So,
that reminds me of starting an IV. If you're not comfortable when you're starting an IV, you're not going to get it. You got to get yourself comfortable. You got to get the patient in a comfortable position, and then you'll nail it.
Yeah. Too many women, like they're anxious. They're in a funky hospital bed. I had one mom say, I feel like I'm being swallowed by this bed. And I'm like, okay, let's just clear the playing field. We got to make this easy. We got to simplify. Too many people think more is better. Like, I need this, I need that, I'm going to need this, I'm going to need that, I need to. And you don't. I mean, it's really just Just deep breath, take it one step at a time.
Gotcha, yeah.
You know, you gotta have baby in the right position.
Gotcha.
Your shoulder, hip in alignment, nose aligned with belly button, nose to nipple, right? So that the baby has to reach for it. It's like driving a car, gas and clutch, gas and clutch.
You get used to it. There's a lot of fear around not having enough milk, not providing enough for your baby. How do you calm that fear usually? What do you say, or what do you reinforce to them?
What goes in must come out. You watch how much the baby's pooping and peeing. First of all, that's terrific. Is the baby content? Is the baby going to the breast at least 8 times in 24 hours?
Is that the number?
Yeah, it's a pretty good number. You know, as adults, we need 3 meals a day. But if we're not getting 3 meals in, something's a little off. So you gotta get at least 8 in, probably more. So it is a full-time job plus overtime and no immediate benefits. So, but they come.
Cluster feeding. Explain it to a new mother and why it's important. Yeah.
It's important, and you know what? Most babies will have some periods of that. It is frequent feeding where you can't tell where one feeding ended and the next one began. The baby just wants to live on your chest.
Okay.
You think, oh my God, the baby must be starving. It is the way the baby really facilitates your later milk supply. When you think about it from a baby's perspective, they just came from an environment where they didn't have a care in the world. Now they are outside going, what the heck just happened? And they know instinctively, this is the next new habitat for me. 10,000 years ago, when I was born in a cave, if I wasn't in close proximity to another human being, a wolf was gonna come get me. It is a really strong biological urge.
Yeah.
It has been, from a biological perspective, imperative for the baby's survival. They are programmed to be in love with that breast.
Is cluster feeding a choice, or it's something that the baby just does? Like when I was reading some of the comments, it seemed like it was, do you decide to cluster feed or do you not?
I wouldn't say that.
Okay.
I would not say
Gotcha.
that. If you have a parent who is paying attention to their baby, the baby will likely at some point have cluster feeds. If you're letting the baby have it at will, then the baby will probably use cluster feeding to drive up mom's supply. Later on, when the baby's having a growth spurt, they can likely cluster feed again.
Yeah.
Breast milk is very much demand and supply. If it's demanded, it's gonna be supplied.
That's also why after women are done breastfeeding, a lot of times they continue to pump. Is that correct?
They can. Yes,
Yeah.
sure. You know, they've gone back to work. Maybe the baby has said, oh, that bottle, man, that was so much easier and so much faster. You know, and forget the breast. Women will then continue to pump and then just continue to feed the baby breast milk through a bottle.
Yeah.
Oh my God, can I say one thing about painfulness? Do not use tea bags.
Do not use tea bags.
No, I was on a website the other day and it said, oh, and tea bags can be so helpful, blah, blah, blah. Tea bags have got tannin, which is not useful. They may feel good in the moment, but it is not useful. A wet tea bag on the sore nipple. Yes. Some people have used that as a home remedy. I thought that had died 30 years ago, and it still apparently is out there. It will contribute to more cracking, dried out nipples.
Glad we got that out there.
You know, finally.
Sarah asked, how would you help a mom who's dealing with their child teething?
Usually by the time a child is teething, they have a little receptive language. You talk to them. You cannot talk to a baby too young. And so you talk to them. Oh, you gotta be gentle, no biting. I will say this, a baby cannot breastfeed and bite at the same time. So there are 2 times when a baby's gonna bite you. When you put it to breast and it didn't want to be there. Or at the very end of a feeding when they're done.
Yeah.
So they're nurse, happy. And then that jaw will imperceivably shift and go sideways. And that's when you know, oh God, the baby's about ready to bite me. And you put your finger in the corner of their mouth and you prevent that. You don't want to scream no, you don't want to flick their cheeks, you don't want to do anything that is going to freak them out. Then you can cause a nursing strike. Like they're too afraid to go back, to the breast. But you can protect yourself and say, you keep biting, we can't nurse. Because you know what? If they're biting, they're not nursing anyway. They're not interested in doing what they need to be doing. It's a 2-way street at that point. And then you just take a break.